It's very scary, and yeah, you do have the guilt being a mom. You want it cured, you want it gone, you don't want your child in that kind of pain, and it's very painful for them.
As dentists, tooth decay is the #1 problem that we see in children. We see new patients every day of every week, all year round. I've been practicing for nearly 36 years, and this is a problem that isn't going away, and in fact is getting worse.
Yesterday in the office, I had to extract 4 upper front teeth and 4 back teeth on a child that was 2.5 years of age, and all because the child was not brought to the dentist for care early.
As a doctor, I see the impact of poor oral health on children's health and well-being. If your teeth are decayed, if your mouth hurts, it will affect your ability to eat. And if you're not eating properly, then you don't grow, your brain doesn't grow, and you don't develop. They don't gain weight, and they're more susceptible to infections, even colds and the flu. So the mouth is really a gateway to the body, and if it's not in good shape, the rest of the body isn't in good shape either.
I think the parents hear a lot of information about oral health, but they don't relate it to themselves or to their children. And I think that when they do find out that their child is suffering the ravages of decay, they are very, very distraught.
My son Tyler was treated for bottle decay in his mouth. Started with his top teeth and basically spread through the gum line. I felt like I was losing time with him. That's how fast his teeth were going. I had never heard of it before, never seen it before, didn't even know what it looked like. It was actually pretty scary.
Bottle decay, and it's now called early childhood decay, is an infective disease process in children who are given a bottle all night or who are breastfed all night. And that constant exposure of those teeth to those sugars in those fluids, combined with the bacteria that are in the child's mouth, allow the bacteria to produce acids, and those acids dissolve the enamel, and the bacteria invade into the tooth, and decay begins.
When it first occurred, he didn't realize it, and he didn't really complain. But when it started getting bad, it was a lot of sleepless nights. He was cranky, irritable. His eating habits were very bad. He couldn't chew anything hard. I brought him to Leonard Smith, and it was automatically decided that he would go through surgery, which is pretty scary when you have a kid at such a young age, because you're wondering, should I let him go through this?
The procedure can be done either in hospital or in a private surgical facility, but the children do have to go under a general anesthetic. This puts a lot of burden on the child as well as on the family.
It was so much stress, you know, the whole time, that when it was done and he was better, I think I just, I've never been so relieved in my life.
I think that the important message for parents to know is that their child's mouth is just as important as the rest of their body. And prevention, an ounce of prevention is worth a pound of cure. Getting your child to a dentist early before they start complaining about things is the way to go.
If we don't prevent it from starting at the early ages, we're going to see that much more in the later ages. Baby teeth are very important in the health of the permanent teeth. If baby teeth are allowed to decay and continue to decay, where you get infection and abscesses on these teeth, that abscess can damage the developing permanent tooth, which lies underneath each of the baby teeth. And if you have disease and chronic disease in a mouth, that's going to affect that child's general overall health.
It can affect the way they speak, the way they chew, the way they swallow, how they receive nutrition. It can affect the way they sleep, or if they sleep. It can affect their performance at school. The most important message that I can leave you with is to bring your child to a pediatric dentist by the time his first tooth erupts, no later than age 1. By doing this, we have an opportunity to create healthy teeth and smiles that will last a lifetime.
We all need to be more aware of the connection between oral health and overall physical health. So educating the public, educating children in school about good oral health care, brushing, flossing, dental checkups, eating healthy foods, avoiding foods that increase the likelihood of cavities. Those are all important messages that we need to get out and educate the public about.
I wanted to take part in speaking to parents out there because I don't want any parent to go through what I went through. As soon as you have a child, as soon as you know anyone that does have a child, tell them to go see a pediatric dentist and have their mouths checked so that you can be assured as a parent that your child's fine.
It's time to take the bull by the horn and try and take a different approach. And as an individual practicing pediatric dentist, I've chosen to write a book. I've chosen to go out and speak to the consumers about this problem. And that's my contribution to give back to the community. Prevention is the best treatment. And if we begin the preventive process early enough, our children will grow up happy and healthy, and they'll have winning smiles.